So I'm turning it over to my wife right now. She's going to take over with the last 5 questions.
Okay, so if a person, I guess, has an appointment with you who has uncontrolled diabetes, what advice would you give? I think you've somewhat answered this question over kind of where to start, what you know topics you would go over, but anything additional would you give, such as, and I'm gonna add to this because I work with diabetes educators. So when it comes to monitoring, like how to monitor blood sugar, finger sticks, like those technical things of learning how to manage your diabetes once you've been diagnosed. Can you go into depth with that?
Into depth with monitoring?
Yeah.
Okay.
Because I know you talk about, yes, you talk about diet and all of that, but then there's other things that you have to talk about, the site of where they're going to inject the medication, if they have to be on injectables, oral medications, taking them with food, and, how that works, finger sticks, and, other things that you would talk about as well.
Yeah, it's a good question. So I would add a few things too. So when a person comes to you with out of control diabetes, we really have to key in, because individualize, to see what exactly is going on, because an individual could be injecting themselves, but they may not be doing, injecting properly. They may not be holding the syringe down, pinching the skin, so all the medication is coming out. If they're taking insulin, so their technique maybe needs to be assessed and reevaluated. They need to be retaught. So the reason for their uncontrolled diabetes for this particular person, which I've had patients that way, because they're not giving they're not administering the medication correctly, right? Or it could be someone, like you're saying, like they're taking their oral meds at different time, or they're not taking it with food, or they're having reactions, so they stop taking it. You're like, I stopped taking it, but you didn't know. So you just kind of have to go over all the circumstances for that particular person. We have, the diabetes self-care, management strategies that we go over with each individual person. Once we go over all that, we check the boxes, we'll figure out what they need. But again, it depends on the person. So for example, uncontrolled diabetes, what does that mean? So if a person comes in and their blood sugar is like 400, 500, like they may need to go to the emergency room, right? Like they may need to get like fluids, insulin, especially if they have ketones in their urine, which means that the body is now using fat for fuel, the sugars into the bloodstream, and it could lead to diabetes, ketoacidosis, diabetic coma, and death. So out of control blood sugar is kind of like, what are the numbers? What exactly is out of control? What's the range? I could have a different person that comes to me in the clinic and their A1C is 13. Right. So then I would work with them and see what exactly are they eating, go over those strategies. What are they doing activity? Are they taking the medication properly? Are they monitoring? How are they monitoring? Do they have a CGM or insulin pump? Are they tracking? Are they problem solving? If they see something that's high, they ate something or did something, what are they going to do to correct it? Are they calling the clinic when there's an emergency? Like, so diabetes self-management is like 98% the patient doing everything you've taught them to do. And if they're not following up with that, then there are, concerns. So we teach them these things. So I don't know if that answered your question. It's really just individualized. There's no like one tip that I would give someone with uncontrolled diabetes, but as educator, I would say we have to go through each person's scenario, see what they're lacking, and then educate them and teach them, have them follow up with 2 or 3 goals, and then monitor them, track them and evaluate them over time. And it's really up to the patient to come to their follow-up visits, to make that phone call, to start testing their blood sugar. It's really all in their hands. After we have done the work, it's in their hands.
Right. So I think you answered our next question of self-management skills that you teach. And it appears that you also help to coach a patient through managing their own chronic diseases as well. So you talked about going through the finger sticking, what happens when you have low blood sugars, what happens when you have high blood sugars, when you notify a provider, what are signs and symptoms that you need to go maybe to higher level of care. So that is very, for new diabetics especially, learning how to, that part is takes a little bit of practice. So of course, the close follow-ups, reiterating the same thing over and over again helps people really feel more self-assured in how they manage their own diabetes. And one big thing that I've noticed since working with more diabetes educators is transitioning care, as far as coming from a hospital, they've been diagnosed maybe in the hospital, and then they go to outpatient, and then they're attached with a diabetes educator. So how do you assist in transitions of care, such as discharge from a hospital to an outpatient center?
Okay. All right. So let me follow up on your two questions. So I did cover a little bit about, what self-management tools, self-management skills that I teach, but the AADE, which is the American Association of Diabetes Educators, we have AADE 7, and we go over healthy eating, activity monitoring, taking medication, problem solving, coping, reducing risk. So I'm qualified to teach all those behaviors, like you said, like hypoglycemia, how would they know if they're having hypoglycemic reactions, unless they're hypoglycemic unaware? What is high blood sugar? Give them a range and say, if your numbers are in this range, you need to contact us, or you're willing to do this. So we teach them all those self-management skills. But the goal, like I mentioned before, is for them to do the work. Is for us to guide them through it and teach them how to check their foot care, eye care, when should they be going to see their ophthalmologist, kidney and heart health, should they be counting carbs, how do you count carbs? And I check them. I'm like, okay, can you show me what you do? I have them tell me what they do, and then I correct them, because simply asking your client or your patient, oh, you know how to count carbs? Yeah. Okay, but you have to evaluate, how are they doing that, right? Do you know how do you give yourself insulin? Can you show me what you do? Because that is a big issue where people's patients say, yep, I know how to do it. And they're like, oh, they could do it, but we don't check. So I would say that as an educator, that's a big thing that we just need to double check and actually watch the patient follow through with these skills. Now as I mentioned, the Academy mentioned that diabetes educators can be lifelong partners and advocates, but you, the patient, are responsible for 98% of your diabetes care. And so again, I reiterate, the care is in their hands. So back to that question about discharge. So when I worked in the hospital, I wasn't a diabetes educator at that point, but I was very much into the field, and I worked as a dietitian. They would first need to consult, the physician needs to consult a dietitian to have the patient know how to eat properly. They also need to consult a certified diabetes care education specialist. Sometimes a dietitian is both, sometimes there's a nurse educator, right? It just depends on who they are. Once they're in that room with those educators, they are given tools and tips and resources to follow through with, learning. And then we quiz them to see if they have learned, and then we have them teach back to us what they have learned, to make sure they're really comprehending. And so at the end of that evaluation, and the patients get ready to be discharged, we will provide that information for them to follow up, to call, to contact their local outpatient diabetes center. Okay, so we give them that information. In the hospital, they should be given a list of who they can contact, right? That's affiliated with the hospital, or they may need to call their insurance or their physician, but they definitely need to follow up with an outpatient diabetes center. Now, also the nurse at discharge, I believe, goes over discharge instructions, which includes numbers for them to call. So I would say transition in care from inpatient to outpatient starts with a consult from the physician or the provider, because without a consult in the hospital, we don't know if the person has diabetes. They could have diabetes and be discharged and never seen the diabetes educator or the dietitian because they weren't consulted. So that's the number one issue, that when I worked in the inpatient setting in the hospital, we'll have patients discharged because they weren't consulted. They didn't consult us. We just didn't know. But there are things in place now. That was many years ago. There are things in place now where it automatically triggers, once you have diabetes diagnosis, triggers a consult automatically, because now the way that we see patients is more electronic, so things are not missed as much as when they were written in charts.
That's very good to know. There's a couple of times where I've had patients, especially with COVID and all this stuff, and they had diabetes, and it was a whole, process. But, the diabetes educator, or like you said, the nurse educator would call and get in touch with me, and then, they're coming my way, and then, hey, they're going to need these meds. And then it was a lot of coordination.
Yes.
So I was very very happy that I wasn't, just the only one doing it.
Right. They kind of helped you.
Yeah, I had an extra pair of hands and eyes to help. But I mean, literally, the patient knew where they were supposed to go, what time the appointment was. I mean, what meds they needed. They had the meter and all this stuff.
Yes, you teach them how to use the meter, everything.
So I was relieved, which goes into my next question of, if you are a patient, right, who is like, I've been struggling for years of, can I get some help? You know, how do you go about initiating a conversation with your provider or with, maybe you don't have a provider, but how do you go about getting a diabetes educator if you wanted them a part of your team or a part of your management?
Right.
How would you do that?
Yeah, this is a very good question because a lot of patients have diabetes for years and they don't know what to do.
Right.
So I would say as a patient, right, you really, if the patient has diabetes, they need to kind of ask themselves, who can best take care of me right now? Who, right? And many people don't understand though that they need to see an actual specialist. They need to actually call their primary care, right, and inquire about a diabetes specialist because unfortunately, let me give you an example, right? Let's say you had a 65-year-old grandmother and you took her to see the pediatrician. Do you think she would have the best care going to a pediatrician? She's 65 years old, right? No, pediatrician are for children, right? And up to I think 21 years of age. So the point is that whenever there's a diabetes issue, a lot of healthcare providers, some physicians, I'm not sure who their providers are, they try to manage that person by themselves. They really need to refer out. They really need to give that patient a referral to see an endocrinologist, right? So they would first of all see endocrinologist, which is a physician who specializes in endocrine disorders, and the patient needs to be aware. So here's some questions that they may ask, right? They may ask, are you a specialist? This is what they would ask their physician. Are you a specialist in diabetes? And they say not, then you would say, can you recommend me to see a specialist? And what is the number that I could call to make that appointment? These are questions the patient should be asking, right? And then who makes up my team? Who's the team of my diabetes educators? And are there types of healthcare providers that are gonna help me? For example, the Joslin Diabetes Center where I also work, we have psychologists, we have pharmacists, we have social workers. So the patient should be asking, is there a team? Who's the team that I'll be working with, right? And whenever the patients have challenges, these are the particular people that they may go to. Diabetes adds stress and burden, and some people with diabetes have to see social workers or psychologists. They have particular people that their niche is just diabetes. And we would send them, we're going to send you to the social worker that's specifically for diabetes to help care and send you to the proper resources. Because as a dietitian, if I see they're struggling with, for example, activity, I may send them to exercise physiologist. That's her goal is diabetes, right? But activity for those with diabetes. So, and another question is, which they should ask, how long would I anticipate, do I need follow-up? They should ask their physician, how long do you think I'm gonna need follow-up? They may not know the answer right away. And they would say, who's gonna help me eat? Who's gonna help me to figure out what I should eat for my diabetes? And how often do I need to see them? So these are some questions that if you're a patient, you should write these questions down because they're very important. You need to ask your primary care provider, and if they are not a specialist, you need to be seeing a specialist and the care team. There's no way that you're going to go right to a doctor that's an ophthalmologist for eyes for back pain. That doctor does not work with back pain. They work with only eyes. So same thing with diabetes. You need to go to endocrinologists. They specialize in endocrine disorders such as diabetes. So that's a recommendation. These are just some recommendations I would have for patients that have diabetes for a long time and they're struggling, they're stuck. They really need to see a team of people.
Okay. Another thing too, health departments, depending on area and how that can be a factor too. There are some community resources that can be helpful, like community resources that have classes, like I think YMCA used to do them, or the health departments would have like cooking classes or have resources, every month they have a class for diabetes about a specific subject. So, and some of those are just free. You just sign up So even if you didn't have all of the resources in the world, what resources do you have, and are you activating those resources? And because some of them are just literally free. You just need to know where and when, and that's it.
Yeah,
So,
a lot of
yeah.
a lot of resources are becoming free. Like you said, there's a lot of church resources. I served on my board as a director in the health departments, and I taught diabetes support group classes for free to the community. So something like that, they need to check with their local church or other churches in the community and see if they're offering free classes. Another thing, like you said, the local gym, YMCA, they may have some kind of cooking, physical activity classes that may be free for like the first few weeks, or maybe free if you have a certain health status, and then also there are other programs such as the American Diabetes Association online, diabetes.org. They could go on and find tons of resources. The Academy of Nutrition and Dietetics, which is eatright.org. You could find not only dietitians there as well, but you could find other helpful information and tips. The American Association of Endocrinologists, they may be able to find some things there too. But I would say the ADA, the American Diabetes Association, and the Academy of Nutrition and Dietetics, they'll be able to find a lot of good resources if they want to go more online, because a lot of places right now may not be able to.
And apps.
Huh?
And apps.
Oh yes, there's a lot.
I just started giving folk apps. I was like, look, you need to download this app, that app, and that.
So maybe we could have another discussion, but I have at least five apps that I recommend in my practice. There's at least 10 of them, but they're not all created equal, that also, can help track your blood sugar intake. And they are helpful for providers. But what we use at the clinic is, we use different techniques at a clinic. We help them download their meters. If there's specific meters that they have, it also comes with Gluco. They may have a specific outline that comes with their meter. So they need to also check if they use a particular meter. They may provide free resources, Freestyle Light or Contour, whatever meter they use. Sometimes they provide free app resources with their meters. So that's one place to check as well. Many of the hospitals have outpatient diabetes self-management education programs, which are evidence-based programs that meet or exceed Medicare diabetes self-management training regulations. So a lot of these are covered. And if they have that insurance, right? If they have something that they don't pay anything out of pocket, and they go to their hospital, sign up for the outpatient program. Also, my company, 360 Girls and Women, I teach diabetes self-management education skills, and I help my clients I conduct a full assessment in addition to like tracking and evaluating my client's progress, right? And I also have classes. I also have a Facebook group called Beats Metabolic Disorders. It's specifically for women, but it talks about blood sugar issues, PCOS, right? Because there's other blood sugar issues besides diabetes, right? And so this group, I give specific tips, help, and I offer discount rates to cooking classes and things like that. So that's a place that they can go to as well. And my handle on that is just @360 Girls and Women, and they'll be able to find that Facebook group as well there. So there's a lot of different resources that you can find. It just depends where and how often you would want to get into the information, because if you don't use it, it's not going to be useful. And also be aware of information on the internet that is not true, or be aware of people that pose themselves as knowing diabetes. You want to look for the credentials. You want to look for a registered dietitian credential, RDN, or you want to look for certified diabetes care education specialist credentials. You want to make sure you're going to experts. If you have diabetes, you want to make sure you're going to the real deal. You want to have those tools. You want to get those tools from those individuals that can really help you to figure out, what can I do to prevent my risk of complications? What can I do to live a happy, healthy life? Because I have seen and I have worked with and helped people live a happy, healthy life with diabetes. I also have done the reverse, where I've helped them reverse, if possible, the diabetes. But you need to meet with a team. You really need to work at it and learn the goals, learn the behavior change goals. And it is definitely possible to achieve what they need to achieve.
So what I'm hearing is that you can benefit providers, in managing their patients by definitely education, the coaching, being a second pair of eyes, a second input as far as how to help them navigate some of the turns with diabetes. And also, you mentioned being a part of a team. That I think is a big thing too now, is it takes more than one person to sometimes handle, especially chronic diseases. You need some hands on deck, for them. So, you definitely, a diabetes educator, something people should definitely consider as part of their team, to help them manage their diabetes.
Yes, thank you.
Well, thank you. You just went through it. Anything else you want to add?
Let me see. I think that one thing of value when you say like how do you benefit? I think that last question you were going to ask about benefiting someone. I think that but research shows that as diabetes educator, we help to reduce healthcare costs, right? And if you include medical nutrition therapy, which is what a dietitian, it's a science and art of incorporating techniques to help manage chronic illnesses or different types of illnesses. When you're seeing a dietitian and you're seeing a diabetes educator hand in hand, that is like the most benefit. You're getting so much benefit and value from that. But not only that, you're reducing your risk and you're also reducing healthcare costs, right? Healthcare costs, and you're increasing health outcomes, your outcomes. So it's this very, for me, it's very rewarding to see someone improve and to, improve their quality of life. I mean, I really take it at heart, and I really love seeing people happy, especially, when you can improve their health status.
Yeah.
I think I would close and I would just say that make sure that, you're listening to your body, make sure that you're following up with experts in your team. And if you have any questions for me, you can go to 360girlsandwomen.com and find out. You could click on Instagram, send me a message, or you could email me directly if you want to email me. My email address is complete@360girlsandwomen.com. And I think that's it. There's so much more to go over, but I thank you for having me. And I think this is a good conversation to have. And I hope people benefit from, whatever we had shared today.
Yeah. And thank you, Mrs. Haynes, for blessing us with your knowledge. I know it was a lot. Just so much information when it comes to diabetes, because our communities are being devastated by diabetes, and we'll be discussing at some point high blood pressure as well. But we definitely thank you for coming on and sharing your knowledge with us, and thank you to our audience for tuning in to another episode of Let's Talk Health.